Good evening, ladies and gentlemen, and welcome to the Voices That Heal podcast. I am your girl, Jams. I'm so excited to be with you today. I have a really important conversation to share with you guys, and I'm really excited to talk about it because it's something that I don't think we really dive into very often, but it's something that we as cancer patients deal with quite a bit, but we don't always feel comfortable or feel compelled to talk about it. So, tonight we're going to be talking about mental health. If you know, October is actually a mental health awareness month as well. So, for us, it kind of just, well, not mental health awareness month, but there's days within October that are for mental health, significance. So, I thought it would be important to bring on somebody who can talk through mental health, not only from a professional standpoint, but also from a lung cancer standpoint. And my guest with me today, you may recognize her. She's been around for quite a few things for us. But my guest today is Ruby Blow, and she is a master level licensed professional counselor in the state of Georgia. She's the owner of Development Counts, which is a practice that specializes in the development of mental health professionals. She's taught master's in counseling students for over 10 years as an adjunct professor or a member at Argosy University in Atlanta. And her professional mission is to create a space and conditions for people to meet their professional potential. So she also, in December of 2018, added, same as me, a very grim sort of title to her name, but we're going to talk about the hope behind it as well, though. She added a lung cancer survivor and now advocate for lung cancer awareness in December of 2018 to her title, too. So in addition to caregiving for her mother, who was diagnosed with Parkinson's, dementia, and running her practice, she began her fight against non-small cell lung cancer. And 6 years later, she's also continuing to supervise counselors while taking oral medication and undergoing surveillance for lung cancer, brain metastases, and everything else that comes with having this lung cancer diagnosis. Now, back in 2019, around the time of her diagnosis, she stopped seeing her therapy clients. But she now continues her work with her Development Counts practice by doing supervision, consultation, and training. So the last thing I'm going to mention is that all of the stuff that we do in addition to our diagnoses they're just ways that we take back our lives. So as I talk through her resume and I talk through all the things that she has going on, remember that even though she's doing all these things, she's still battling lung cancer at the same time. So she's also volunteering for ALK Positive. She's had a Team Ruby sort of fundraising initiative where all of the proceeds benefit that as well. And we also work with longevity. We work with all these different organizations, but in the midst of all of these things, we're also just trying to be normal, regular people. And so I think there's something to be said for how much of us or how much of our time is spent really trying to just be regular and just live our lives like we used to before this diagnosis happened. So I really love reading bios that have lists of things that are happening in addition to diagnoses, because it just shows that we are still taking our power back and there is still hope after a diagnosis. So Ruby, all that being said, thank you for joining me today and welcome to the show. How you doing tonight?
I'm wonderful. I'm happy anytime I can sit and especially talk to a fellow survivor,
Yeah.
and
Yeah.
our stories being diagnosed in the same month and year. It's always so crazy to me when I hear that. We didn't know each other then, but we were going through something that would, cause our paths to collide. So I'm just happy to be here, literally. That's what I tell people when they ask me how I'm doing. Even if it's a tough day, I'm happy to be here. So, but thankfully today has not been tough. And
Yeah.
it's always interesting to hear my intro. Someone talk about, my life or my life story. And you mentioned trying to be normal. And, it's really a new normal
Yeah.
when you get a life changing diagnosis. You begin a journey, you don't know where it's going, you know where it could go. And so, yeah, I'm happy to be able to talk about this topic tonight because it's so important. Mental health, it changes you. Getting a stage 4 lung cancer diagnosis, especially at a younger age. I was diagnosed at 44. You were diagnosed how old, Jamie?
I was 32. Yeah. Yeah.
That's just letting that wash over me. It's crazy. That's young. So it changes your thinking about what your life could be, and so it's such an important part of mental health is being able to create a vision for yourself, and the pursuit of happiness and well-being is so kind of caught up in, I want to experience this, I want to do that, I want to go this place, I want to fall in love, I want to, whatever it
Yep.
is. And or in my case, it was, I want to live long enough to take care of my mom. And I did that. She passed away about 3 years into my diagnosis. And because of her dementia, she never knew that I had a lung cancer diagnosis. But I was grateful that because of the type of lung cancer that I have, there were medications that I could take that allowed me to extend my life. And not only that, my second thought after I need to live long enough to take care of my mom was, I need to live long enough to see my counselors get their license. So I was literally in the hospital like, oh my gosh, how am I going to get my counselors across the finish line? And so many of them that I was working with them then are now counselors. And that's, really pursuit of your life's work. That's an important part of well-being. So I think it's important for people to not give up, kind of like you said, their identity, to still have other things in their life that don't really have anything to do with cancer, if you can help it, because sometimes you're too sick and you can't do that. But when you can do more, I think it's important to do that, because why, you have to have a reason for being, and not just fighting cancer. You have to have a reason for being.
Yeah. And I will tell you, I think like one of the main things that I battled with when I first got my diagnosis is like one of the things that sort of masked the symptoms of my getting treated in the first place, was that I was in kickboxing, and I
Mhm.
loved it. I really loved kickboxing. I don't know what it was about it. I just felt powerful. You know what I mean? So when I got my diagnosis, I had to step back from kickboxing, and that for me
Mhm.
was a blow that I was just like, it became a goal for me. I was like,
Yeah,
I'm getting back into kickboxing. Like as soon as I'm able, like as soon as I can shake all these stupid things off, like
right.
catheters and whatever else, I was like, I'm getting back in there. And so I think that's why I put so much like, emphasis on things that we do outside of being diagnosed, because so often you get these kind of diagnoses. And I mean, we're blessed. We can absolutely say that we're blessed. We've been through some things, but there's people who have it a lot worse than we do. And there's people who can't, sort of get back to those same things that they used to do. So the fact that you have the ability to do that, for me, it just is like it's bringing you back to what you had before you had the diagnosis. It's like I'm not, just because I have this diagnosis doesn't mean that's all I am and that's all I can be now. Like I was Jamie before my diagnosis, I'm Jamie afterwards. And so I
Yeah,
want people to remember that and not to be caught up in this idea that like, oh, she has lung cancer. Like I want people to almost forget, like, oh, that's right, you do have that. You're so busy, I forget.
yeah.
Like that's what I want people to think about.
Well, now that you mention it, it's like I am not the person that I was before.
Yeah.
I wish that I was. I'm different in so many ways. I speak more slowly. I have some neuro pain that's very difficult to manage at times. I used to do Tai Chi. When you talked about kickboxing,
Yeah.
I started Tai Chi when I was in my early 30s, and it was a really important practice for me. And oddly, because of neurological stuff, when I would do Tai Chi, I would be locked up after my body didn't want to move.
Mhm.
So some people will have the experience that on some days I do have, like what you described, where you're your old self, or you're yourself that you were before. I am, on the other hand, am one of those people where my life is drastically different physically and even emotionally. And I think that's important in terms of talking about mental health, because I think there's also this pressure when you do have a diagnosis like this to be okay so everyone else can be okay. Because you
Yeah.
don't want people to worry about you. You don't want to feel different, really. You want to feel like yourself. And I've had to come to terms with, you know what? I'm a different self now. And how do I get to know that person and like that person and not hide that person from the world? Like, there's so many times where I say no to things because I don't want to show up as the me that I am now when people were expecting the Ruby that they knew before. I'd much rather show up in spaces where people didn't know that old me, so that
Yeah.
me that shows up is something that everyone is like comfortable with. And it kind of makes me sad to say that, but I think living in your authenticity is one of the best things you can do for your mental health is to speak the truth and only the truth and nothing but the truth. Now, you don't need to do it when it's not called for or when it's going to be hurtful, but I have to be honest about that my experience is different than that. And I think there's sometimes pressure for people who do have a chronic illness to make it look easy. And it is easier for some people than it is for others. And it's because our bodies are different.
Yeah.
So our level of health or our underlying, like, I think what we have, like what do you call it? Pre, um,
Pre-existing.
yeah, not just pre-existing condition, but what you have a potential to develop. Like
Hmm.
if you are already like prone to underlying certain illnesses, there's like the stress diathesis model, right? Where it talks about whether or not it's under a certain amount of stress, you might develop certain conditions. And I think for some people, if they get a chronic illness, now it can unlock their potential for having other things show up within that. And so I'm not saying that's true for everyone. And I think in our community, in the Black community in particular, there is almost a fear for people of speaking the truth of not feeling well because it's kind of like if you talk about it, you're invoking it.
Hmm.
We believe and know about the power of the word, right? Like that's in our church, that's in our music. We believe in the power of the word. So it's almost like then people can't really even say, hey, I'm experiencing this or I'm feeling that, because it's like, hush now, like you don't say that, or just pray over it or whatever. And those things can be beneficial, but it can also keep people very isolated where they don't really want to speak to the truth of if they're going through something. And that's why I think support groups, like you mentioned, my volunteer work, I do support groups in part because I know that decreasing isolation is one of the most important things we can do for our mental health, to not be alone, to not go like into the woods like a lone wolf, right? Like is going away from the pack, not just to explore and find themselves. That's what they do in their younger, healthier life. Later, they're going away from the pack to be alone because they're going to not burden the pack with they're not well anymore. And what we need to do when we're not well is we don't need to stray too far from the pack because we literally are stronger together. So if you are talking to people, if you're spending time with people, you have a better chance of mental and emotional well-being, and that can support you even if you're not doing so great physically. um,
Yeah.
we have a live with a mythology that somehow we can stretch and we're going to live forever. It makes it so where people are afraid of death and dying, and it's like we can't have a conversation about it. I think it's important for mental health and well-being to actually be able to talk about those things so that you can deal with it, meaning your fears around it, and then just live your life. you
Yeah.
you can live your life less burdened by fear if you can talk about the things that are going on.
Yeah, and I think there's you. First of all, I'm way off. I'm already way off my topics.
Sorry,
Like,
I should warn you,
no, it's
baby.
good.
The spirit will lead me, and I will just start talking about what's on my heart.
I am here. We just went straight into left, and I'm good with it. I'm all for it. I'm all for it. But no, I think you've said a lot of things that we should definitely unpack. One of the things that definitely resonates with me, and I always do put a disclaimer over my situation and say that my situation is different from everybody else.
Yeah,
Everyone has their own walk, and
right.
I'm very cognizant of that because at any point in time, any one of us could be any one of each other. You know,
Right.
we could all have in the blink of an eye something. It all it takes is one scan
Right.
to totally upend whatever semblance of normalcy we have. And there's
Mhm.
something to be said for that and what that does to your mental health, because you live in a compartmentalized time frame. You know,
Right.
like I don't know about everybody else and what their sort of frequency is for scans and treatment, but I'm living in 3-month increments. So it's
Right.
like, you know, the clock ticks. And then as you start getting closer and closer to those scans and to those tests and to those things that are coming up to see if you're still doing good, that clock gets louder and louder and louder. And that's where the anxiety or scanxiety, if you've never heard
Right.
that before, folks, that's where that kicks in from, because you're
Mhm.
living in these 3-month increments or these 6-month increments or what have you, where you get the all clear from the doctor that everything's good to go. And it's like, okay, I can
Right.
go back to what I was doing, you
Right.
know, whereas if you do go to that doctor, you get that progression notice or you get that update that, hey, something is there that wasn't there last time. It's a
Mhm.
record scratch, you know, it's a,
Yeah.
okay. And now you got to think about your life from a totally different perspective now. Like, okay, now I'm going to maybe be on a new medication, or there's just a lot of things to consider, you know, when that meeting or when that appointment doesn't go the way you want. And so
Right.
in terms of mental health, it's like very, like I find even on my strongest days, if I'm coming towards scan time, I'm all over the place. I'm a mess. And there's
Yeah.
just like nothing you can do. Like
What does that
it's
mean, strongest day, Jamie? When you say a strongest day, do you mean a day where you just feel great physically and everything's going well? And
yeah. Yeah,
yeah.
it's a day where, you know, it's one of those lucky days where you feel like you can forget, you know, where you just feel
Yeah.
normal. Like you said, you feel like your old self for a little while. Maybe you're doing something that
Mhm.
you used
And
to
you
love
totally
doing,
forget.
or yeah, you're just out and about and you're just living your life and you're just doing your thing and you just
Yeah.
forget for a little while that this clock is above your head ticking. And on your strongest day,
Exactly.
like even when I'd like to think I'm pretty mentally good with trying to stay in a positive mind space and all that kind of stuff. But it does not matter how good I think I'm doing. You come see me a day or two before my scans, unless if I'm super busy, good. But like
Yeah.
if I'm not super busy, trust me, I'm different. There's something different
Yeah.
about me. I'm a little more reserved. I'm a little quieter. I'm a little more in my head, because it's just you're like, did I appreciate these 3 months for what they were? Am I getting ready to look down the barrel of another 3 months that might be totally different? You know, and
Mhm.
that's why it's like you always have to, you know, no matter how great you're doing in your journey, you have to always look at it, you know, on a case by case, day by day basis, because at any given moment, any given scan could tell you something totally different than what you have. So it's
That's
like
true.
it's hard mentally to keep that positive mindset with that clock always ticking so loud above your head.
It's true. I mean, when you talk about anxiety, that is something that those of us in the lung cancer community, those of us who are, I think, blessed enough, right, to be on the medications that you take daily that kind of extend your life, they're not saving you, they're extending you,
Yeah.
right? And so, like you said, every time you get ready for scans, you know there's a possibility that your status might have changed. And then you might have to make a change in medication or treatment and so forth. I think the best way to cope with that mentally is part of what I've already talked about. One, don't deal with it in isolation, have community, talk to other people, share the load. I actually have scans tomorrow.
I
So
have scans next week. It's
we're
like,
on schedule. We're on schedule.
yes,
So
we're
and so
synced
I
up.
have one tomorrow and then I have one next week too. So but there's that. There's to talk about it. And I think too, reminding yourself that you take one step at a time. We cannot live in the future fully. We have to live in the present.
Yeah.
Like did I live that these last 3 months? Well, I'm sure that you did. I just know a little bit about you, but for everyone watching, I think just try to stay in the moment, because anxiety is about the future. Depression is typically about the past. Depression is typically
Wow.
about regret and things that you wish could have gone differently, things that you don't let go of or you're lamenting in your mind. Not all depression is like that, but that can be some of what depression looks like. Whereas anxiety is fearful about what's to come, or what could happen, not feeling comfortable in the moment. So being able to just say, like, you have to have a mantra. For me, mine is right here in this moment, all is well.
I like that.
Just bring myself back to the moment. If I start to trip about the future, I'm like, you know what? Why do I need to live in that future? I'm not there yet. I can be right here and just remind myself to like really enjoy the beauty of the moment. If I'm having a moment with people that I enjoy, I try to savor it and just think, so I'm enjoying this laughter right now. I'm enjoying, sharing space with this person. And the other thing I think too is having support for scans. People like to handle it different. Some people do their scans, by themselves, meaning they just go to their appointment, they get their scan, and it's like the rest of the people in their life, it's just like their day's going. When I have scan day, well, this is every day. I actually have 3 or 4. Don't at me if you're somebody in my community. And
she said, "Don't come for me."
But I have 3 or 4 people that I text every morning, and so tomorrow morning I'll wake up. I'll text those like 4 people, and I'll say I'm going for scans today, or I'm going for my CT today, or whatever it is. And then they'll be checking. Now, these are not part of my lung cancer community. This is just my people that have like been in my life community forever.
Yep.
And they don't understand all of it, and they don't need to, but they've got my back. And then they're just like, okay, have a good scan. It's gonna be, we'll be here on the other side, or whatever. They say something encouraging. I like that. For me, I just like to mentally know I'm not alone. And then I usually have someone drive me to scans. Now, that's just because I don't drive as much anymore. I've just living this chauffeured life since
she's in your soft girl era.
I'm in my receiving mode. I'm so glad you said that. Like, I definitely have learned how to receive. I receive support, and I think my face just says I need help. People just help me. Like, sometimes I have to tell people, don't help me. I can do it. I got it. You know what I mean? Yep. And so, but no, so I like to, like, if it's not my brother giving me a ride, I'll ask a friend, can you drive me to this appointment? And then that way, after I have support, like, let's go get lunch, or let's go run an errand, or something like that. And it allows me to take my mind off of it. So that doesn't work for everyone. Everyone's different. You have to know, like, what's your vibe? Like, what would be beneficial for you? Because I see you making all the uncomfortable faces.
It's not me. I'm sorry. Like, and I'm gonna, you know what? I'm gonna go back into left field again. I'm gonna bring it back to us. I promise y'all. We're gonna get into the meat and the potatoes here. But from the beginning of my diagnosis, I don't want to say I went through it alone, because I have a lot of family members that would jump through this screen and probably choke me out. And a husband upstairs would be like, "Oh, word?" Like, yeah. No, I didn't go through it alone.
Right.
But I didn't have people in the rooms with me. And that was a little bit by choice. I chose to be that way. So, like, even when the doctor came in and I was in the hospital room, it was like my mom and my folks were there when I was in the hospital first going through all of this stuff. But there was a moment where I was by myself. I woke up one morning, I was by myself. Yeah. And the doctor came in and like gave me the news, and I was by myself. And I just kind of, I don't know if that set the tone, or if that was just like, I don't know what it was, but I just remember I sat there in the bed and I let myself feel it, and I cried by myself, and I let myself feel the emotions. And then when everybody started coming in the room, I was able to sort of compose myself and be like, this is what's going on, blah, 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 blah. And that is sort of how I lived my cancer journey thus far. I mean, people ask me all the time, you want me to go to your scans with you? Do you want me to go here? You want me to do that? I'm like, nope, nope. Number one, like, it's a couple of things. Number one, I used to drive 2 hours to get to my scans. So the first thing was like, I don't feel like having to figure out what music do you want to listen to? Do we want to talk? I don't want to have conversation. I want to put on gangster rap or jazz, whatever I'm feeling at the time. Whatever I'm feeling at the time. And I want to drive. I'm going to get there. I'm going to say my prayers. I'm going to talk to the Lord and be like, listen, man, I know you got me. Like, please don't throw me no curveballs, because I'm just I know you
Yeah,
think I'm your strongest soldier, but
yeah,
listen, and I just kind of like to be in my own space and
yeah.
be in my own mental space to get whatever news it is and whatever situations are going to come to me so that I can, not that I
Mm,
can be vulnerable by myself because I don't mind being vulnerable around people, but I think I like to get the first uppercut alone.
yeah.
I can be a little bit braver and put on a better fight face for everybody who's around me. And that
Mhm,
goes right back to what you said about, us always feeling like we have to be strong for everybody else. So when you said that, I was like, oh, oh,
mhm.
my heart. She hit me right in the
No,
field.
but also too, I mean, I think it's important to know yourself and your own process. And even when you talked about just being alone and maybe that setting the tone, the truth is when you have a cancer diagnosis, there are elements of that that no one else can do with you.
Yeah.
I mean, I talk about having people with me and I, uh, I get comfort from that, but there definitely a deep isolation to having cancer, probably any type of cancer. There's one, just the stigma out in the world. Oh, you've got cancer. You're about to die. So everyone's afraid of
Right.
that. And then two, depending on what type of cancer you have, there's a stigma that can be attached to that type of cancer. I mean, there are people who pass away, and especially in the Black community, and we don't really even know what they died from, so we can't even learn from, like, how do we, what are the tests we need to get, what's the prevention we need to do, we because there's such a stigma attached to it. So I think there's a part of me sharing my journey that's also helping the people in my community not have me be unknown.
Yeah.
Like, this happened to, my mentor, my sister, my friend, and or my niece or whatever the case might be, and I don't understand it. That's not going to be my people, not my people that are close to me. They're going to understand what was happening and how to potentially support me, I hope. I mean,
Yeah.
a lot of information. Like, I can't even pretend to understand all of it, but I think that for me, there's something about bringing people along that says, hey, I'm trusting you to help me.
Yeah.
Because, but it also depends on, where you're at in your journey and what your needs are. Like, I deal with side effects from treatment. I Some people don't have as many side effects from treatment. So their level of need might be different. I think it's okay to be handling this based on who you are. But if you know there's a part of yourself that feels probably a little bit more sad than you feel comfortable with, a little bit more anxious than you feel comfortable with, then I would say talk to someone, whether it's finding a therapist, or finding a cancer community. I hope you're part of a cancer community. That's really important because there are some people who were not going to understand your journey, period. And that might make you feel more isolated. So you might need more than one thing. You
Yeah.
might need a support group and a therapist, or you might need to open up to that someone in your family who keeps saying, hey, I got you. Can you talk? Can we talk? Look around and see who's been extending their hand to you, and take their hand. And I mean that metaphorically or physically. And then also say no to things that you don't want. Like, Jamie, I think it's really cool that you did your 2-hour commute and you listened to your jazz or your what kind of rap did you say?
It's either gangster rap or jazz. I'm either
Whatever.
rapping angry or I'm
I think
peaceful
that's
and
really
zen.
cool that you have your ritual that supported you, right? And so that there's no right or wrong. It's just more tuning into how's that going for you? How is it working for you? And giving yourself permission to do something different or to be open to something different if you think it could help you.
So, well, I mean, I think this conversation has been really good, and I do want to continue talking the way we are, but I also know that we need to jump into the mental health side of things a little bit
Well,
too.
I want you
We're-
to know that I have been talking mental health.
you
Talked
have, but I
about
have
anxiety and depression. We talked
I,
about support groups and therapy. We talked about not comparing yourself to other people so that you don't like feel worse. I want y'all to know because people think mental health is one particular thing. mental health is global, but I want to get into the things you want to make sure we talk about. So you tell me, Jamie,
We
what are
are.
some of the things? Okay.
We are hitting mental health for sure, but there are certain
Okay.
things that I want to share with the community and sort of highlight to the community. Like you said, the same way you said, anxiety is about the future and depression is more about the past. People
Mhm.
are chiming in on that kind of stuff and they're really, hitting on those kinds of things. So I really want to make sure that we're giving the resources and stuff and kind of dispelling some of these myths around mental health. I think
Okay.
our journey as survivors is 100% valid and it's really good too. And I think that us sharing our parts of the journey also helps with that mental health aspect. But I think there also is, there's some kind of just extra stuff that I think folks may want to
Sure.
use for their own side of the journey too. So I know that you are, a licensed counselor, and I think that that probably makes you a little better equipped, I would say, to probably deal with your own mental health. Do you think that that is something that has helped you kind of, you know, go through your journey a little bit more, in tune with what's happening? And for those folks of us in the community who are not sort of licensed professional counselors or who don't have a history or a background
Mhm.
in this kind of work, what kind of sort of suggestions and stuff can you give for just a beginner person trying to get a grasp on their mental health as a whole?
Yeah, I'm glad you mentioned a beginner person. I want to speak to like someone who doesn't have a mental health background and maybe even someone who's newly diagnosed, or you've been diagnosed for a while but you're just starting to think more about your mental health. I think when you're diagnosed with lung cancer, it's such a shock to the system that I think there are almost these stages you go through mentally, probably similar to the stages of grief where you're just trying to come to terms with the reality that this is really happening to you. It doesn't feel real. And it can be very difficult to even feel fully like you're in your life and in your body,
Yeah.
because you're when we are traumatized, we disconnect. And I think having gone through the experience, that's how I would describe it. There's this outer body moment where it's like, what, this can't be real. Okay, okay, this is real. Okay. And you're trying to like integrate everything that you're being told that you're experiencing and so forth. And so I think the first element of, I think, mental wellness, if you will, that we can work towards is integration, which is kind of acceptance of what is,
Yeah.
acceptance of, okay, this is happening in my life. And then what meaning is that interjecting into my life? What does this mean now? You and I kind of talked about that as we were sharing our journeys, what it meant to us, what it meant about changes in our experiences, what we were capable of, our relationships, our responsibilities. So there's the first part is, I'm in shock. Is this really happening? All the stuff that gets thrown at you that you need to now do. And then somehow the world is still the same, but your world is flipped upside down.
Yeah.
I think the first part is just getting integrated into the reality of what is happening now. We can come back to those moments over and over again. And we also touched on this when we were talking about scans, because scans can come and take you back all. Now you feel like you're going back to the beginning, but you're not, because you've got experience. You've got experience now in how to deal with this. And it can still feel very scary, but it actually isn't the same as the first time. And so you have to give yourself credit for, I've got experience now with surviving. I don't care if you've survived one day, 1 week, 1 month, 1 year, 2 years. You have experience as a survivor. And
Yeah.
so I think integrating the reality, the new normal, that I am all these things I was before, but now I'm a person who has been diagnosed with this thing and is living with it. And you have to also determine, what are the things in my life that are going to support me? Now, this is mental mindset, right? Like when we talk about mental health or mental wellness, we're talking about your thoughts. What are the things that you're saying to yourself. And then we're talking about your feelings. What are the things that you're saying to yourself and how does it make you feel? And then as a result of those feelings, what does it lead to in your behaviors? And the truth is, we're going also through a physiological process that can interfere with our normal programming. Okay.
Yeah.
Your normal programming may be offline. Like my normal programming went completely offline. Different systems of my body are completely different, right? There's a grieving that we talked about before that can happen with that. And I think to stay mentally well, you have to be willing to live with change. And
Mm.
change is the only constant in life. And
Yeah.
one of the things that people struggle the most with, I would say in therapy, that people come to therapy for, is usually they want to change something in their life, right? They want to feel something different. They want to, whatever it might be. But change can be very challenging when you're trying to make it happen. When you have lung cancer, change is happening all the time and you don't
Yeah.
have any control. You're just along for the ride. And so you have to adapt. I think mentally, one of the biggest things you can adapt to is a willingness to accept change, but also to adopt the mentality of empowerment. What are the things I can do something about? And to stay motivated enough to do something about the things that you can. And that loss of motivation that people can experience at times, sometimes it could be physiological, it could be what's happening in your body because of medications or treatment. Um, I'll give you an example too of just, probably we need a doctor to talk about this, but we know that, for example, when people have heart conditions, they're more prone to depression.
Yeah.
People who have heart conditions are more prone to feel depressed. Well, we know that the lung and the heart functioning are so intimately, they work together, right? It makes sense to me that on a certain level, someone who's dealing with lung cancer may also at times feel very, like, you know, existentially, on an existential level, depressed. And so to normalize that sometimes you're going to feel down, and then to kind of give yourself permission, okay, what am I going to do about this feeling down? Am I going to let myself just feel this for now and just like let it be okay? But don't go into 2, 3, 4 days. Like pick yourself up. Like it's
Mm-hmm.
okay to feel down because that feeling was there and it's like a storm. Storms sometimes come through, but storms are not meant to last. And so just reminding yourself that sometimes it's like that with mental health. A storm will come through, it's bringing that rain. That rain might be beneficial in some way. That depressed mood might be giving you a chance to take some rest and recharge because you were out here running around too much or something. And now the sun comes out on the other side and you can move about again. For some people, that depressed mood, they might even go into their journal and start journaling. They might pick back up and get back in with their therapist again. They might go back to, you know what, let me join that support group meeting that I haven't been going to. And they might, pop into support group. So I think when we talk about mental health, like I said, it's mental health is your life, period. It's just whether you're reflecting on it or not, that's you doing something about it.
Yeah, 100%. And I think to go along with what you said too, that first step of grabbing a hold of mental health and really owning it is integration. I think joining those support groups, like you said, like there's so many organizations out here that you will find that
Mhm.
leaning if you need it. If you need to
Yeah.
lean into others, you'll find it there. And so I think understanding what's out there and understanding the resources that are available to you is also part of that. Just because part of that feeling of helplessness and like depression and sadness is like, what am I supposed to do? How do I do this? How do I help myself? You have
Yeah.
to understand what's out there. You have to know where to look and who to ask and where to find those resources. And joining those kind of groups can really knock out 2 to 3 of those steps for you right then and there. You could just put that in
Right.
that group and they will swarm you with everything you need. Go to
Yeah.
this site, do this, talk to this person. Let's just love on you a little bit, give you a little extra boost of
Mhm.
serotonin, whatever it might be. I think that's really, really important. I'm glad you mentioned that for sure.
Mhm. Yeah, the overwhelm is, I think, you mentioned that in what you were just describing. I think that's a typical thing that can lead to kind of feeling down. It's like sometimes there's so much to do. It's like, get this appointment, schedule that, go see
Mhm.
this specialist, talk to this doctor, change to this med, try this treatment strategy. And you're like, and you don't have a chance really to, like, fully be with yourself. So I think taking those moments for sitting down, being with yourself, that's what it is when you sit down for meditation, or when you go to do yoga, or when you're on your drive. You're really giving yourself, your brain, that processing time to be with you and to kind
Mhm.
of come back to yourself,
Yep.
right? And come back home to yourself, and not all this overwhelm that this new identity and this chronic illness, if you will, that's impacting your life.
Yeah.
So yeah, and you mentioned organizations. I mean, I don't know if we're naming any, but if you search for lung cancer related organizations, every single one is going to point you in the directions that you need to go to find support groups. I
Mhm.
think for anyone who stumbles across this, who's not connected to anything, I would say don't let fear keep you from searching, getting information. Because I think that anxiety or fear, I've meet people occasionally in groups or in meetings where they're like, okay, I've never been to anything like this before.
Or pride. I think pride plays a key role in this too. A lot of people are like,
Right.
no, I don't
Tell,
need help.
tell
I don't
me
need the
more
group.
about that, Jamie. What do you mean?
I mean, I know folks in my own personal life, in my family, who like absolutely refuse to seek support groups and things like that. Maybe they don't need them, that's fine. But on some level, I think it's a pride thing where it's like going to that group or connecting with those people kind of makes it too real for you. It makes you like,
Yeah,
so it's like, you got to, sometimes you have to,
it's another way to
it's
look at
okay.
it.
It's
Yeah, yeah.
okay.
I think pride is an interesting, another way to describe it. I mean, I think it comes down to fear, right?
Yeah.
When you go past what is pride about, it's like, okay, I don't want to be viewed as this thing, as this whatever. And that, you take away that mask, what is that about? Well, if I'm viewed at this thing as this thing, then what does that mean? That
Yeah.
means that I'm someone who's dealing with something, and fill in the blank, whatever that is. And I don't want to be that person. Well, nobody wants to be it.
Yeah.
That's where I go back to acceptance of what is. That's key. Like, it's, you know, you can't deal with anything. You can't describe it, name it, talk about it, be real, be authentic, be, 100, which is another thing we pride ourselves on. Like, are you really keeping it a buck if you can't even go talk to other people who are dealing with the same thing as you?
Yeah.
You know, not that that's the gold standard. Like, again, some people, they may feel more comfortable in a one-on-one, but I can tell you as a clinician, as a therapist, when I had clients before who had cancer, before I ever had a cancer diagnosis, of course I gave them the best level of care I could, but I didn't understand what they were going through. And I'm not saying that a therapist needs to have had cancer to be of service to you. That's not true. But what I'm saying, as someone who is a cancer patient, nobody gets us like us, period. So I'm saying you probably need both,
Yeah.
because you need a level of empathic understanding that just comes with sitting in a space, whether it's virtual or in person, with other people who just, you don't even have to say the words, get it. Even if what their stuff looks like is different than yours. There's like a deep kinship.
Yeah.
Is the best way I can describe it. It's like going somewhere in everybody's family. I mean, how's that not healing?
Yeah.
Voices heal. Look, voices that heal lungs. How's that not healing? I mean, I feel the same way when I'm in my counseling community. Like, there's things that only my other mental health professionals, like, when we're together, we get each other. We have a shared professional values where we see the world in a particular way. So
Yeah.
community is important. I believe in circles of community.
I believe in that too.
as support. Like, we're not, there are parts of this, like I said, that you do alone, but why do so much of it alone if you don't have to?
I agree. And so I know we've given a lot of conversation to us as patients, but you have a very unique perspective from this conversation as also being a caretaker and a
Mm,
patient at the same time. So I
mhm,
want to talk a little bit, if you can. I understand it's a very emotional conversation to
mhm,
have, but I want to talk a little bit about what it was like for you to go from being a caregiver to your mother while also needing care for yourself simultaneously. And just what were some of the things that you did to prioritize your own mental health while you were
mhm.
caring for your mother, and did that kind of play a role in how you care for your mental health as a patient too?
Oh, wow.
Sorry, that's a hard question.
No, I mean, it's important because so many
Yeah.
of us will be caregivers in our lives, right? And even if you're a parent, technically you're a caregiver
Yeah.
because you're constantly taking care of a little one or a little big or whatever, however they are. And then you get to a point where, maybe your parents are aging and you will be caregiving with them, or you have a spouse, partner, friend, someone. So we all will have an opportunity to care give, and some people will step into that role. And I was that person really for both of my parents. And so what I will say about that is that caregiving forced me to really get rid of anything that was non-essential. And
What do you mean?
what I mean by that is, if there were things that were dragging me down or pulling me down or dividing my attention, I only had attention for, I need to take care of my mom and I need to work so I can take care of myself. And that's part of entrepreneurship. That's a whole other bag. We should talk about lung cancer and entrepreneurship. But so,
Yes.
so I was very, very focused on taking care of my mother, and I think that probably delayed me getting care for myself. And I would say for to anyone who caregives, it's really important to know that um, I think caregivers actually have a higher risk of illness post caregiving. And I think it's not just that divided attention thing I was talking about, it's the stress. Caregiving is the most stressful, joyful job you'll ever do. I miss taking care of my mom, even though it was hard. I think about the funny conversations we would have. She had Parkinson's and she would say funny, cute, sweet things all the time, even if it was by accident. And even when she wasn't speaking, I still felt that connection that you get from taking care of someone. So, with that being said, tune in to yourself and listen to your body. If you're still caregiving, which happens right now, people living with lung cancer who are still caregiving to someone, whether it's their adult children or a spouse or someone else, I would say expand and ask for help. You should not function at the same level as a caregiver once you are diagnosed with lung cancer. You need more help supporting the other people that you're caregiving, period. And that's what happened for me when I got diagnosed. My siblings who were already doing some to help with my mom, they showed up more. And so, and in some cases, I just had to say, hey, I need this, or can we do that? Or, and then also my friends. Oh my goodness. My friends, I didn't realize how much support they gave with me helping my mom, whether it
Yeah.
was helping move her from one assisted living to another, to, helping me get her to urgent care when she needed it. I remember one night I was in about ER with my mom. This was shortly after my diagnosis, probably less than a month. And my mom needed to go to the hospital. I'm there with my cannula, trying to breathe. And my mom's in her wheelchair. And the doctor comes over and is like, okay, which one of you are we?
Yeah. Both of us knock. I need a little help
We
too.
were both on the struggle. But I called my brother to tag me out. I was like, I'm hungry. I'm tired. I need you to come and be here with mom in the ER till they get her a room, and I'll come back tomorrow. I need to go get rest. Or, basically you have to set limits. If you are caregiving, you have to learn how to set limits and get help to help whoever you've been caregiving. You can, of course, let your loved one fall through the cracks. Depending on your relationship, you can't do that. But what you can do is open that door and say, hey, I need help. Now, some of you might be thinking, my friends wouldn't do that, or I don't have people to call to ask for help. And what I would say to you is you need to start cultivating that, period. This is a skill set that you can learn to cultivate. Form relationships with people, with organizations, with communities. Like one of the spaces to do that for some people might be church, right? Church communities are great for pitching in and helping serve others. Depending on the age and the illness of whoever you're caregiving, there are communities of support within those organizations as well. If it's a senior or an elder, lean into the senior care services that are part of your county services or your city services to see what they have available that can support you. So don't give up to the idea that there is no one. It's just that you haven't identified them yet. It could be a social worker through one of your medical offices that can point you in the right direction. But I would say the most important skill set across the board we've talked about for your mental health is get support, have support, give support.
Support.
It's true.
Yeah. Yep.
Mm-hmm.
So I think we're running out of time here, and I have two very important questions I want to ask you that I want to make sure we get a chance to ask.
Okay.
The first being, and because this is like a big, I don't want to say it's trending or anything like that, but self-care is big now. Everybody's talking about self-care and self-love and all that kind of stuff. Can you talk a little bit briefly about how self-care or self-love and mental health are connected to each other?
I love the way that question is phrased. First of all, whenever I hear self-care, I think about how that term spread like a contagion out of the therapist community, because self-care is something that we talk about professionally because it's intended to help prevent burnout, to deal with burnout, right? And then it's like it took off like wildfire, and everybody's like, "Hey, we need self-care too." So, I think that sometimes the things that we do for self-care can look frivolous. And so people tend to think, you're just using this as an excuse so you can go get a pedicure or you can, go have your girls' brunch or whatever. I think the most important thing about self-care is to recognize the sacredness of it. That self-care is, like you pointed, it is loving yourself, caring about yourself enough to take the time to just attend to something that you need or want. And to allow yourself to be self-centered, to be self-focused, which especially for women is something that can be very taboo. We don't want to be viewed as selfish or self-centered. And those things already mean something bad. And I mean it in the best possible way. So sometimes loving yourself means like giving yourself permission to just give yourself something that you need or to say no to something that you don't want. And I think that's important. Sometimes we can't do the thing that we need for ourselves until we say no to something else. Most of us have way too much on our plate. And so therefore we fail at, if you can fail at it, I think you can fail at self-care because our plate is too full.
Yep. And I think people, the phrase "you can't pour from an empty cup," I say that all the time, and I say it to myself too. It's like sometimes you just need to step away from, even if it's like just take a nap for 15 minutes. If it means refreshing your battery, you're no good to anybody if you yourself are torn apart and falling apart at the seams. You need to be in the best possible shape you can be to care for other people too.
There's an element of like being overworked, overrun, that it's protective. It's like if I get still, what's going to happen? What's going to show up? Right.
Mhm.
So sometimes self-care is like, okay, I'm going to face this moment, being in the present and dealing with whatever shows up
Yeah.
and being kind to myself. That's self-care.
Yeah.
I hope I answered that
You
question.
did. You did. We have 3 minutes, and now I have another
Okay.
question to ask. So now
Okay.
I'm messing myself up because I'm adding stuff in.
Okay. That's all right.
But I think one part of the lung cancer journey that a lot of us don't sort of talk about either is the stuff that the uppercuts, the things that like we didn't realize we're gonna take away from us so much,
Mhm,
or
mhm.
we're gonna hurt us so much. So I
Yeah.
want to see from you, like, what are some of the aspects of your lung cancer journey that have affected you in ways that you didn't think it was going to be like a problem? For me, I'll go first is because I have it at the top of my head. I think losing people in the lung cancer community is a lot more damaging to me than I realized it was going to be. I think
Yeah.
getting connected to people who have this terrible thing in common with you and losing them, it
Yeah.
does there is something there that is so powerful and so damaging and so hurtful to your spirit sometimes that it's like I have to take a step back sometimes, like, damn, I did not I did not think this was gonna hit me this way, you know?
Yeah.
And it's just you're like, I don't know if it's like you see yourself in a reflection of them or what
Yeah.
it is, but that is something that I didn't realize was gonna be so hard to deal with as a lung cancer patient.
I agree with you. I mean, I think for me, that's not the unexpected thing. And I think it's but mostly because of my walk of life. You know, my life's work has been sitting with people dealing with painful things. So
Yeah.
my life has prepared me to be close to people who are going through something difficult and who are many going to die from that. You know, we could die from something else, or maybe there could be a cure. You know, that look, maybe there could be a cure. I like to think that we could be headed for that, for more different types of lung cancer. And but I will not. I want to speak to what you just talked about because I think this is so important. The way I look at losing people in our community that I've gotten to know or that I've been close to is that I got to get to know them. I got to share space with this usually amazing, incredible humans. Like, I don't know if prerequisite for lung cancer is you got to be an incredible human. I don't know. I wish that wasn't it.
It is.
I wish that
I'm gonna
wasn't
say
it.
it is.
But I think what if everyone was afraid and shied away? This person wouldn't have anyone to share this important part of their life's journey.
It's
And
beautiful.
so I think of it as an honor. It's a terrible honor, but it's an honor. It's
It
an honor
is.
to
It
be
is.
able to be close to someone who's going through this and to share ourselves with them as well, and to be able to speak to their journey, to be able to continue some of their work. I feel like we are links in a chain that's like it's heading somewhere, or we're part of a stair step, or whatever you want to call it, but we're all connected. And so it's not one life, it's multiple lives all tied together. And so that reduces some of the pain around it. There's pain there for sure. But to me, it's like the way that I look at pain is different because of probably my proximity to it in terms of my work.
No,
I,
I think it's not that. I'm sorry to cut you off. I don't mean like, oh yeah, I didn't think I was gonna care. Like, no, I knew I was gonna care, but it's like
yeah, of
on some
course.
level, we all know, like we all
Yeah,
expect it, but it's so unexpected at the same time. Like we all have like you said, this hope that like, no, 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 not us. Not us.
yeah,
We're good. Like that may happen to those people out there, but not
yeah.
us in
No,
this circle. And so it's so
I get what you're
wonderful when
saying.
you lose folks, you know?
It is, and I totally agree with what you're saying. I only intend to add to it, not
Yeah.
diminish from what you just said. And I
No, I
think
just didn't wanna sound crass when I said that. I was like,
no,
maybe I
no,
didn't
it
say
did
that
not. It
correctly.
didn't. It didn't, Jamie.
Yeah.
It doesn't. But I think it's the reason why I wanted to distinguish how I relate to it is because I know that our different journeys do bring us to different ways of experiencing certain things. And I think anyone who's watching this, I don't want you to be afraid to be close to people because you might lose them, you
Yeah.
know, because you will miss out. They will miss out on you and you will miss out on them. So I think it's that part is still to me the unexpected thing has just been actually that I'm still here. I did when I got that stage 4 diagnosis, I thought I was going to
Yeah.
die. So
I could see
I'm
that. Yeah.
I'm just glad that I'm still here, and I look forward to the future of what's going to happen with lung cancer research and treatment. I want to keep living to see the innovations and to benefit, and that's what's unexpected me. Your girl's still here. Period.
Yes, you are. Yes, we are. Well, I definitely am super glad that you're here. And I think, I mean, you are an amazing human. And as soon as I thought about having this mental health conversation, I said, I need Ruby. Like, y'all don't know, but Ruby, like, she facilitates our support group that we have for Black women in the lung cancer community, and she is on it. Like, we'd be we'd be in there laughing, crying, everything in
Sharing
between. And so
life.
I just knew that I was like, I need her to have this conversation with. And you have such a unique perspective as patient, caregiver, and professional that I'm like, you can talk to it from all the different sides of it. So, but I don't want to leave this show without giving you an opportunity to shout out either your contact information or any of the organizations that you're supporting, because they are a big part of who we are as patients. So go ahead and take a minute and shout out the contacts and the things that you need to promote while we're still
Well,
here.
I want to just say thank you to Heal Collaborative because they are such an important part, I think, in particular of lung cancer in the Black community. That work is amazing, and you know, we had our first annual African American Patient and Caregiver Lung Cancer Summit in
What?
2024, and we're having another one. And
Yeah.
look, I have said that title so many times because I'm so proud of it. It's so impressive. And there's going to be another one coming up in 2025 in Houston. So I want to shout that out first. And the Voices That Heal Lungs group is a Facebook group that people can join if they're part of the lung cancer community. I'm a member of ALK Positive, meaning I volunteer for alkpositive.org because that's my biomarker. We actually share that. And so I think it's a great resource, not just for people with ALK, but people with any type of lung cancer benefit from the research that's funded. And then I also just want to say for mental health, period, if you are ever experiencing a mental health crisis, it doesn't matter where you are in the US, you can dial 988 and get resources and support. You can get support for crisis. You can get support for finding mental health in your community. You can find a peer counseling line to talk through calling 988. If you're a veteran, they'll put you through to the Veterans Crisis Line. So I just want to mention that number 988 for those who do not know. But also, look, that's it. That's a good place to start. Those are good places to start.
Well, Ruby, I want to thank you so much for your time today, for your ability to just be so transparent and to really talk through these things, you know, from such a genuine standpoint. I really, really appreciate it. And I don't know if you see the comments, but the audience has really been identifying with the nuggets that you've been dropping as
I
well.
have
So
not seen any comments the whole time. I'm just talking to you, Jamie. So I'm glad
that's
there
good.
was an
Well,
audience. Hey, y'all. Bye, y'all.
the audience is loving it. So I definitely appreciate your time. Guys, stay tuned. There's going to be another one of these conversations next month. There's actually going to be 3 next month. So we've got Caregivers Month, we've got Lung Cancer Awareness Month, and we have Smoking Cessation. So there's going to be 3 of these podcasts next month. So make sure you stay tuned. Little secret sneak peek. I'm definitely doing a Black Women's Lung Cancer Roundtable for the November conversation. So part of the selfish reason why I stopped our conversation earlier tonight is because you're sharing too much. I need that to be,
Doing too
I need that to be next month. Keep some of that in. So
much.
that's all I
Okay,
was
got
trying to
you.
do. But I definitely appreciate everybody tuning in tonight. Special thanks to the Heal Collaborative for supporting this and sponsoring it. Thank you to everybody who tuned in tonight. And if you want to connect with any of us, please feel free to leave a comment on this video. We're live on YouTube as well. We will definitely continue the conversation with you. Until then, everybody stay safe. Have a good and safe rest of your week, and we'll talk to you soon.